What do you think, first of all, about the awareness of endometriosis in New Zealand?
It's not a word that everyone's heard of in terms of a disease profile, but it's a problem that affects 120,000 girls and women.
And that 120,000 you talk about, that's 1 in 10 women in New Zealand, isn't it?
That's 1 in 10 girls and women in New Zealand. So we're actually talking about a major public health issue as big as some of the things that are household names, diabetes and asthma and other conditions of the same proportion. But it doesn't get the same airtime, it doesn't get the same profile, it doesn't get the same research dollar, and it certainly doesn't get the same clinical importance, where it has a major impact on those who have it.
Why do you think it doesn't get the same airtime per se as other conditions and other diseases?
My take on that is that it's about periods. So if you come back and say, what's the baseline here? And then a lot of people, society would generally think that perhaps isn't an okay thing to talk about in public, even today. In fact, I would go as far as to say that endometriosis is one of the last remaining medical taboos of modern medicine.
Now that 1 in 10 we're talking about, wasn't that carried out quite long ago?
I have a funny feeling it's around about 10 years old, that literature. So if we were to do the same kind of robust study that went into that, then I think that we would be finding, in fact, that statistic is inaccurate, and it's probably a great deal higher than that.
Are we in a position to do another study on that, or
not in New Zealand? Really, we're not in a position, because when we look at the monumental aspects of endometriosis, and if we were to, even if we had the likelihood of us choosing one study that we could follow, would that be the one?
Now, moving to funding, you guys are obviously a non-profit organisation, Endometriosis
Yes.
New Zealand. Do you want funding from the government?
Our key focus right at the moment is improving clinical pathways. So there is an acceptance that we're looking at a major public health issue, that the clinical pathways fall well short of meeting the needs of New Zealanders, and yet there isn't any ministry money. So that means this not-for-profit organisation, as you said, is actually following that off our own financial back.
So is progress being made, do you think?
I'm always optimistic about progress, and I'm always optimistic about, the positive things that we can do from a practical point of view as an organisation in supporting girls and women, but also in an outreach kind of approach to improving clinical pathways, for instance, and improving the knowledge of health professionals, and also making this, it's easy to point the finger. You've got an 8 to 10 year diagnostic delay. Is that all about GPs? Or do they have actually the tools at hand, the pharmaceuticals at hand, to be able to improve the lives of their patients? So it's definitely multifaceted. I still get excited about it. While I'm still getting excited, I'm still motivated.